want you to live a lifetime to feel every moment sharper, every wound to heal. The stars burn brighter, the sky looks wide. 1 year's enough to find the fight inside.
Hey everyone, welcome back. So today we're going to talk about my oncology appointment, which I had on Friday. I recorded this anyway, the oncology appointment. So I'm going to split that down into little sections so people can understand what questions I asked. But before we delve into that, what I want to do is touch on the symptoms from last time. There were one or two which I missed off by mistake, which I'm quite surprised really, considering they were a big part of it. So one of the symptoms which I had was where we were always needing to pass urine. So no sooner I had been to the toilet, I find that I need to go again. That went on for quite a considerable amount of time, and I remember saying to my GPs about that as well. How I was constantly needing to go for a wee and everything like that. Again, they never really took that on board or anything like that. And then obviously there was the bleeding from the rectum area, so when you go to the toilet, you'd end up with blood on the toilet paper. I was putting them down to hemorrhoids, and I think maybe the GP did as well. They were itchy, pain as well, and I kept mentioning this to the GPs and stuff like that. And again, you really think that would have triggered something in regards to, well, hold on a minute, you got the hemorrhoids, you're going to the toilet a lot, you've got all these other symptoms, you've got small lumps, even some larger lumps which are prolapsed, you've never feeling like you've emptied your bowels enough either. It's like no sooner had you been to the toilet, you're like, no, I still feel full from that. And the complete tiredness. So I do question whether really there was the missed opportunities there from the GP who could have just ruled everything out. And it kind of annoys me as well, because when you think about things like that, if they had possibly, this has been going on a number of years. It's like if they had actually listened correctly instead of just fobbing you off all the flipping time, then maybe we might not be at the stage in which we're at now. And potentially I could have had that colonoscopy done a lot sooner, just to rule it out. But again, it comes down to things in regards to like bowel cancer. They look at the over 50s. Well, no, anyone can get it. We hear about children, like I touched on in the last video, how that really upset me seeing that at the Christie's. So end of the day, maybe GPs need to listen a bit more to the patient and go, actually, let's rule this out. Let's get you the test. Let's do the possibility, it could potentially be. And maybe I wouldn't be in this situation, but with everything what's going on, I'm kind of the what ifs and all that lot. One thing which I found difficult lately is we've been going to a lot of older places, like, it could just be travelling through or something like that, and it used to be, oh God, yeah, remember that time, we're doing this, that, the other, and in my head here, it's, just think, you weren't living with cancer, you weren't living with this diagnosis, what you got, that always went life were good, although I may have been suffering the symptoms, might sound silly, but if you like, I was blind to what was going on, and that does upset me, because I think should have just left everything that day, not gone to that appointment, not made, so I said to Saz, don't make the appointment. Would I be suffering the way which I am? Would I still be dying the way which they say I am? Would I be going, I had to go through all the rubbish what we've been going through, and yeah, it's the what ifs and everything, but I can't really think that way, can I? We've been dealt what we've dealt. We've got to deal with it. And yeah, as crap as it may seem, You know, you just got to deal with it. So yeah, today's video, I'm going to be cutting it out a little bit. I know I normally do it just raw and everything like that, but I'm going to have to do it this way because I recorded the oncology appointment on Friday, which I had. To be quite honest, we felt a bit fobbed off. Obviously, you're going to listen to the audio for it and the questions which I asked as well. And again, I do feel written off, you know. But well, we are where we are. There has been a little update in regards to what I'm doing about it now. Um, After listening to it, what people have turned around and said in regards to your cure's been rubbish. So yeah, so there's going to be little cuts and edits and everything, but I'll try my best with it. Again, it's still going to be raw and uncut and everything because I hope one of them bloody watches it and sees what they're doing. And yeah, might give them a slap in the face to bloody wake up and not write people off under the age of 50 who've still got that bloody fight in them, regardless of how my days have been these last few days. These last few days have been hell for me, and I'm sure they've been hell for my partner and my friends around me, you know, because I have been so flipping depressed. I have been at that stage of wanting to give up. God, I'm going to get emotional. I don't want to give up. I feel like all the doctors, everything like that, are just giving up on me. And I don't understand why. Um, yeah. And I've got to that point of they just want you to roll over and die. Well, no, I'm not flipping doing that. Just because I might be an inconvenience and expense to you. Well, you spend the money on the over flipping 60, so spend it on me, who's got a lot more to flipping give in this life. You know, I'm far from flipping dumb. You know, so yeah, my emotions at the moment are everywhere. But yeah, I've got it in me. There's a lot going on in my head. So yeah, we'll go through this oncology appointment and yeah, see what you guys make of it. Because like I say, I just feel like we're fobbed up again, and it's just a no on everything which you mentioned, really, and just suck it up, Simon, and deal with it. Well, guess what? I ain't. I am calling it out. So, as I said, basically, I've recorded the oncology report. Well, not report, but conversation, which was happened on Friday. And the first one part of it is in regards to chemo. Now, this week I should have actually had my chemo, so today we're on Thursday. Yesterday should have been my last day of chemotherapy in regards to round 2. But sadly, that isn't going ahead, and I'll just play the audio now for you in regards to what the oncology consultant said.
So, we'd hoped that we could give you treatment on Monday, but unfortunately, your blood test from yesterday just show that your neutrophil count, which is one of your white blood cells, is too low to give you treatment on Monday, unfortunately.
Ah, right, okay.
And we need that to be at a certain level because without those neutrophils, you can become really poorly and get severe significant infections. Obviously, we don't want to happen when you're on
Could that have anything to do with like HIV medication or anything?
Potentially could be. So yeah, I'll chat with the consultant to see if we need to add in anything extra to your treatment to try and keep your white blood cell count boosted.
Yeah.
But it's a normal thing to happen, but we just hope by this day it recovers. But with you it hasn't. So yeah, it potentially could be due to your underlying HIV, and we'll just need to work out what we do about it, whether we need to give you an injection to boost your white blood cell.
Yeah.
Okay, but don't worry about it. You'll just have that done when you come.
Right, okay, no problem.
Okay.
So, yeah, obviously chemo didn't go ahead on Monday because obviously the white cells were meant to be low. Now, this is a bit which I have a real problem with because last week on Thursday, so a week today, I actually went for a blood test done at the Christie's. Now, when we got there, we were told a 40-minute delay. People after me weren't told there were a delay and they were going through like anything. In the end, it turned out 10-minute wait, so weren't too much of an issue. But then when it goes through, the lovely nurse doing my bloods, can't fault her. Again, I always say this, the nursing staff have been absolutely fantastic. I mentioned I have got chemo on the Monday, and she looked quite confused about it. And she went, well, why are you having your bloods done today? Because you normally have them done like 2 to 3 days beforehand. I'm sure anyone who's going through cancer treatment at the moment and maybe chemotherapy will understand that, yeah, you normally have it like, 2 days, maybe 3 days beforehand. Now, I've actually got the thing in regards to, my treatment and everything like that. And in that, it actually turns around and says that it's 72 hours beforehand. So that would mean 3 days. Now, bear in mind, I'm the 4 days beforehand. It's like, well, why have you got me here so early? So she was a bit worried about that, if you like. And she asked one of her colleagues, and they said, no, he shouldn't be having his bloods done till about maybe Saturday, even Sunday. And they still went ahead because, like I said, you're here, we may as well just do them. Maybe that's the way which they're doing it. But then I get that oncology telephone call because they did tell me, the nurse, check with your oncology in the morning. And that was one of my first questions which I was going to ask. But yeah, I'm just wondering whether they actually messed up again. Because let's face it, that's been a common occurrence, hasn't it, with everything. Mess up after mess up, or delay after delay. So yeah, I do question whether that is the case. They messed up, they took the blood too early, the appointment was made too early. Instead of admitting that and saying, sorry, we got things wrong, Simon, I'd be like, okay, can we make sure that doesn't work, doesn't happen, in the future. It's important I have my chemo, especially if it's meant to be along my life and remove all my symptoms, or help to relieve some of the symptoms, which it has, so it's important to me. But yeah, as she said, I said in that, she'll check with a consultant to see whether I need the injection for the white cells. Heard nothing about that. The appointment for Monday, not heard anything about that. So yeah, even bloods, they were meant to get it at the local hospice to me, just so then I didn't have to travel all that distance. Well, that was meant to happen today, if it was going to happen, because I know that hospice does it Tuesday and Thursday. I told her that. But again, here we are, Thursday. The only appointment I've got today is with my amazing storm nurse. But I've heard nothing else. I did get a text message on Monday to tell me when my next oncology appointment is. The end of the month. That's all I've had off them. Are they really caring? I don't think they are. So yeah, chemo this week hasn't gone ahead. You may notice something as well. It's deal with the elephant, as they say in the room. As you can see, this has been rapid this week. And this has been a big thing for me. I always said I don't mind losing my hair, as long as I don't have the other symptoms like the nausea, diarrhea, constipation. And I can deal with losing my hair. Nah, sad reality, I couldn't. This has really hit me this week. I tend to have a bath every day because that releases some of the symptoms down below, and it just makes it soothing and I feel okay. But yeah, when you got your bath full of your hair, you wake up in the morning, your pillows are full of hair, your t-shirt full of hair. It's been a big shock to me. And that has been a lot to do with why I've been down the last few days. I know I'm a man. It's different for women. Because obviously women have longer hair and stuff like that, so it's going to be a bigger shock to them. But I didn't realise how much of a shock it would be to me. Because my hair's just disappearing. And it's going rapid. You know what, it was nearly 3 weeks ago I had my chemo. I started losing my hair a bit and then it stopped, and then in this last week it's just been rapid. So yeah, it's been a lot to deal with that psychologically. But this morning I woke up and I thought, embrace it. I've got to. So I've decided today is the day that I'll be shaving it off. And I might look like a far right fuck, I don't know. I've never had a bald head. Well, I've had it short, but it's probably been a bit longer than this. I didn't like the look then, so yeah. But well, shave it up, deal with it, and fails and it don't look right, stick a hat on it. Maybe I should get different coloured hats. Maybe. I've got an idea already from the chemo sessions. I'm going to start wearing t-shirts which call out everything what's been going on. Got very smartly dressed, and everything like that. But yeah, then when I got to take the jacket off, there it is, calling it out, but promoting the channel at the same time. So yeah, I've just got to embrace it, haven't I? As upsetting as it can be. It'll grow back, I know that. Once the chemo's finished, it'll grow back. I've heard stories about how it can grow back different colour and look different to what it was. Curly and stuff like that. Hey, fine. I love a bit of curly hair. Never had curly hair. So, something different in it to embrace. I never know, I might suit it. So, yeah, I've just got to remain positive, I think. I've got to tell myself, you remain positive because your positivity will wear off in the end with everything as well. And yeah. So yeah, that was in regards to chemo. As I say, it's not happening this week. It didn't happen. And I ain't had anything to tell me about Monday yet. All I know is they booked the appointment. What about bloods? What about this injection? Do they really think I'm going chasing them at this centre of excellence? No, you can off. I've done enough chasing. So, yeah. Let's see what joke they come up with next, isn't it? So, yeah, that has been about chemo and why that's not happened and the side effects of chemo at the moment. So yeah, that was all that really about chemo. So the next question I asked is in regards to how confused I am in regards to having the liver shadowing when I've got letters confirming that I hadn't spread, and I think there were about 2 letters in total of that. So yeah, what I'll do is I'll just play that audio now of when I asked that question and stuff like that.
Any questions or anything at all, Simon, or is that all quite clear?
everything's clear with the chemo. Like, I do have quite a lot of questions. I think they're probably more aimed at for me to speak with a consultant about, really.
Well, I am in lieu of the consultant today, so if you've got any questions, you can ask me.
Yeah, no problem. Like I say, we've got quite a few, because it's all just been very confusing, you see. Like from day dot of being diagnosed and everything like that. Like we've been chasing literally when we were under Northern Care Alliance. We were just literally chasing all the time.
Okay.
One thing which really, really confuses me is in regards to when I was at the bowel clinic at Rochdale, I think it was, and I seen Dr. Byrne. One question which I asked him was, had it spread? Now, according to him, it hadn't spread, and he had the scans back, which showed that it hadn't spread. Now, literally 3 weeks later, no one had told me in regards to another CT scan which I had that it was showing shadowing on the liver. It was a surgeon who was meant to do the myostoma who told me.
Yeah.
And so, as you can see, there's been no communication in regards to that. Like, and I'm just a bit confused how quickly it spread.
I mean, unfortunately, the type of cancer you have is aggressive, and it might be that the scans initially, it's difficult to say whether it was there, but very poorly visualised. So sometimes scans, they just don't pick up very small lesions, particularly CT scans. And then over that period of time, they become more apparent, more obvious, hence why it was seen on the second scan.
Right.
Or whether it wasn't there, and then unfortunately because of the aggressiveness of the disease, it would then became visible on the next scan. But I completely understand why that would be very confusing and upsetting. That the first scan, everything was clear, looked clear, and then you were told quite soon after that actually that wasn't the case.
Yeah, because the only reason I question it is that we only spent literally 5 to 10 minutes with Dr. Byrne, and then he passed us off to the CNS, and she spent 5 minutes with us, and then I was packed on my way.
Was this on the first appointment?
This was when I was diagnosed, with cancer. Like I say, that was under Northern Care Alliance.
So I am looking at, I've got your CT scan from the 27th of March, which would have been your first CT scan, I believe.
Yeah, I think that would have been right.
And having a look at the results, it does say there wasn't anything at that time visible in your liver. And then when you went on, and then let me see the other, you had a PET scan next, didn't you? An MRI of your pelvis and then a PET scan.
Yeah.
And then on the PET scan, it showed that potentially there was something in your liver, that it was a bit concerning, hence why you went on then to have the MRI scan. But I think in the meantime, you had another CT scan, which also showed, as you're saying, that there was some, that there looked like there might be something there, but they've described it as small and very ill-defined. So as I said, it was there, but very difficult to actually see.
Yeah, because like I say, even with the PET CT scan and the other scan which I had at Fairfield, and that was done by A&E, they never mentioned anything to me about it. And on that CT scan which I had done at A&E in Fairfield, the actual consultant doctor person there, he was just like, oh yeah, because the reason I had that done is because of a potential blockage. And that, and he just said, oh, there's stools there, you just need to try and pass them, and he never even mentioned anything about it.
I'm sorry. I don't know whether he just omitted to tell you for whatever reason. I obviously can't speak on behalf of their decision, because it is all whether he was looking at the pictures of the scans and didn't yet have the report, because they're quite, because they were very small and very ill-defined on that scan. It might be that the doctor didn't see them, whereas the radiologist reporting it, so that's a doctor who specialises in reporting scans, was able to see them.
Right.
So yeah, that was the response in regards to being confused about being told you got cancer. Obviously, I had to ask that question because they're going around the flipping roundabouts with it, and then I remember particularly asking, right, firstly, is it cancer? Yes. Secondly, has it spread? No. Surely, though, it would have shown up if I had this liver issue. It's just all very confusing, and it, the scans had shown, but no one bothered to tell me. I had to find out of the surgeon at Oldham who was meant to done the stoma after I were admitted into A&E overnight after presenting myself there. So yeah, still confusing. As you can see, the curve not there again. I don't know whether it's me overreacting or not. What am I expecting more? No, I'm not. I'm just expecting when they find things like that, tell me. So yeah, that's in regards to the diagnosis and the confusion in regards to, well, how was it spread so quick? Advanced cancer. The cancer what I've got, it's advanced. So it's all what you get. But she says it's small. Well, what are we doing about it? What's chemo going to do for it? You don't really get any answers. You're just left in bloody limbo. So, yeah, that's that one. Let's move on to the next one, shall we? And see what that turns out to be like. So, yeah, that was that. So, one of the next questions I asked was in regards to my testicles, and I'll play you that recording now.
One thing which I also mentioned to Dr. Byrne when I was diagnosed at the bowel clinic was in regards to my testicles. I don't know whether that's been documented at all.
We don't have the documentation from the first appointments. We only have any letters, like referral letters.
Right.
What was your concern?
Basically, I get a dull ache in them, and that's been constant. And I have noticed one or two little, they feel like pimples. It's like, and again, he just dismissed that. He just said, oh, if you're concerned, see your GP.
Let me see if that area is on your pelvic, is on your pelvic scan.
Yeah.
Not commented on in anything on your MRI scan.
Right.
But that potentially could have been because it was mainly aimed at your rectum that they were looking.
So yeah, they were just aiming at the rectum, nothing else. Cancer patient mentions, about the testicles. Just ignore it, eh? Is it me? I just think it's not the first time that I've mentioned that either. And even more of that conversation, there were nothing like, well, maybe it's something what we should look at, maybe arrange another scan for you. None of that whatsoever. So, yeah. So, yeah, that's that one. The next question which I asked was in regards to treatment, and again, I'll play that audio.
Well, originally, the letter which I got, it said obviously we were looking at chemo, radiotherapy, and potentially surgery. It's like, and obviously all that's gone now, isn't it? It's like it's just chemo,
Yeah, because we know that there is disease in your liver. There's surgery wouldn't be an option, and radiotherapy. This basic chemotherapy for this type of cancer that you've got. Chemotherapy is the first line best treatment for it.
Yeah.
So yeah, in regards to treatment, I'll walking up his chemo, because it's spread now to the liver. Obviously, can't have anything like surgery or anything. But they didn't mention in regards to like the primary site, whether if that tumour shrunk or anything like that, whether it could possibly be removed, which would relieve a lot of the symptoms, I suppose.
what I've experienced and stop them from coming back, and would that stop it from spreading from anywhere else? There's all these questions still, and it just feels like, no, you're having this treatment, that's it, I'm done with it, and we'll just see how it works out in the end. Yeah, I don't know, maybe I'm wrong, I don't know. Just let me know your thoughts. Yeah, but I just feel forgotten about with it. It's like, and just simple little answers like that, and that's all what you get. And yeah, so yeah, like I said, I just find short answers. That's it. But same with the next one. It were about the liver. Question which I asked about that. So I'll just play you the recording so then you can hear what I asked and what the response were.
Because in regards to the liver, like, could it not be related to how I used to drink quite heavily, like, and I'm talking over a long period of time, or the HIV medication?
No, unfortunately not, because it looks, the appearances of like what the effects of alcohol on the liver and tumours in the liver look very different. And the MRI scan that you had recently did confirm they were the tumours in the liver.
Right. Okay. I thought I'd just check that one because, like,
No, absolutely. Feel free to ask any questions at any point if there's anything you're not sure about or want clarity on. That's absolutely fine. Fine.
So yeah, that's in regards to liver. I thought I'd ask that question because I were heavy on alcohol. I'm not going to deny that fact, and years I've abused my body with alcohol, even drugs. Not afraid to admit it. I'm open book. And then you got like the HIV medication, which is known to sometimes affect your liver and stuff like that, and it can even affect the white cells as well. So yeah, these are the questions which I have to ask, and you just get that simple thing. What makes me laugh in that is previously we're known as shadowing, and now it's a tumour. Okay, weren't told that, were I? Again, no communication. So anyway, let's move on to the next thing. So yeah, so the next question I asked was in regards to clinical trials because I have heard there's some clinical trials and stuff like that. So I thought, oh, may as well ask the question. You never know. And this was the response really to that. And then yeah, so I'll play that right now for us.
Is there any clinical trials which I could do? Because I heard about, is it the Leron or something?
Yeah, no, unfortunately there isn't at the moment, Simon. I'm sorry.
So again, there's no clinical trials, nothing of, oh, well, we can always have a look to see whether there's anything out and about, Simon, anything like that, or whether there's anything up and coming which you could potentially go on. It was just like, no, there's nothing like that for you. So, yeah, there you go. That's it, pal. It's great, that, isn't it? And I live in hope that there's something, but, they just seem to give me a no or it's too advanced, I don't know whether it's me just overthinking, but yeah, we'll move on to the next one, which I think was about my dentist and stuff like that. So like I said, the next part, it's about my teeth and everything like that. So yeah, I'll just play you the recording, it gives you the idea.
Yeah, because I know Dr. Byrne originally, he mentioned in regards to having chemo, like I'll get mouth sores and stuff like that, potentially.
Yeah, well, potentially people do, but it seems like you've evaded that.
Yeah.
So, as we say, we go through all the side effects in anticipation that you might get any of them, but some people get all of them and some people get none of them. So, yeah, we just have to let you know of all the possible ones so you're aware.
Yeah, because the reason I mentioned that is that obviously my teeth are in a bad state, and they mentioned that they would also look at sorting out a dentist for me, and I've never heard anything about that since.
I don't know how I would go about organising that from here. Who was it that said that they would sort that out for you?
Dr. Byrne and the CNS Geordie.
Okay, because I think it would have to go to one of the local services, wouldn't it?
I'm not sure because they just said that it's something they can sort out for me. So,
What was do you need work? Do you think on your teeth?
Yeah, I need work on them, yeah. I've only got my bottom lot, and some of them are missing and not in a good state.
Have you got the number for his secretary, Dr. Bird's secretary, see if you could phone them to see if they've sent anything off for you?
I don't think I've got their number, no. Like I said, my care, to be quite honest, with the Northern Care Alliance has been absolutely shocking. They've left me in the pain since having the colonoscopy. You know, that was awful because I didn't take a sedative. It aggravated everything, obviously. And since then, that's where we're getting the pain in the rectum. And, you know, it was horrific pain. And they just left me in constant pain. It was only my GP who actually did anything. And
your GP would also be able to see if they've written that referrals have gone off to dental care.
Right, okay, so what I'll do is I'll make an appointment with them and the
Maybe
GP.
speak to your GP to see if anything's gone off from their form, but I don't even know because we're obviously such a specialist centre, I wouldn't know even which dental services would cover your area. So yeah, I think you need to ask your GP.
Yeah, so don't know why she was asking me questions, and how am I meant to bloody know? And I just felt like she didn't really listen that much in that, you know. And even when I mentioned about how poor the care's been, again, you know, yeah, blasé about it. But anyway, we'll move on to the next question. I think that was in regards to like the cycle of chemo and everything. So yeah, the next question which I asked was, you know, I'm on 6 cycles for the chemo. Obviously, like I mentioned at the beginning of this video, I should have had round 2 already, so I should be recovering from round 2 now. Sadly, that's not the case. It looks like it's meant to be Monday, but, well, we still ain't had anything in regards to the blood test. You know, whether I need this injection. Yeah, so I don't even know whether it'll go ahead on Monday or what. But yeah, so I asked in regards to the 6 cycles of chemo, and I'll just play you that now.
It's like at the end of this 6 cycles, what will happen at that? Like I know, like in between, they have this scan, isn't it?
Yeah,
And
you'll have a scan after 3 cycles, and if the scan shows that everything is being controlled, you'll go on to complete 6 cycles, all being well. If you tolerate it, continue to tolerate it, and things. And then after that, you'll have a scan for 3 months following the end of your treatment.
Yeah, and then you know, like say, like I tolerate it well, like and it works well, like because I say, you know, the pain has gone from that area. It seems like it's working to me, and I'm feeling quite upbeat in myself, like I used to be. You know, after the 6 cycles, like obviously, would there be further scans months along to see whether it's come back? Yeah.
Exactly, and then we'd work out what next treatment would be best for you at that point.
Right. Oh.
So yeah, you know, not whether you'll get further treatment. You know, it's just like, well, we'll just see where we go from there. Again, you're just left in limbo. Yeah, you know, you don't really get any defiant answers, and I think that's the most frustrating thing for me. Is there's never a real answer. It's a part answer I find. You know, you don't get any positivity really. It seems very negative all the time. Yeah, and again, you know, I just feel it's a lack of care. You know, surely if they want me to remain positive, well, give me some positivity in that, you know. But yeah, you know, so it is what it is with that. And then I think the final question I asked really before they wanted me off the phone was about the 1 year thing. I mentioned about the 1 year thing, and the response to that, you know, was quite different. So yeah, the next part which I mentioned really was like the 1 year thing, and again, she was just like, yeah, you know. So yeah, I'll just play you that recording.
Obviously, Dr. McNamara, she mentioned the prognosis, and she did say 1 year for it, which everyone seems shocked at every time I mention it. Like, okay, you know.
Well, it sounds like you're so well, aren't you, at the moment, and how are you feeling now?
Yeah. Yeah, I am well. Well, I feel wellish. But yeah, there were no hope given there that, oh, well, that's only the prognosis, depending how you respond to chemo, that could be a lot longer, your survival could be a lot longer. There were none of that, Again, I just feel like they never give you any hope. And that's the most annoying thing at the moment. So, yeah, that was basically the oncology telephone appointment on Friday. And like I say, it don't really give you anything to give you some hope, something to hold on to. And that's the most depressing thing. Like I suffer with depression and anxiety anyway, so no wonder these last few days I've just felt so down because you'd expect them to give you some glimmer of hope and to say, well, there's always things coming out to the market, in regards to different trials, different treatments, and all that. And yeah, you just don't get anything like that. You just get simple little answers and left to it. And yeah, and you know, one thing throughout all this is what really sticks in my head. I know I'm going to get upset. I'm bound to. That's I don't want to die. I really don't. You know, just knowing that you're facing death is scary. I don't know what it's going to be like at the end. I watched my mother die from cancer because she refused treatment, and I can understand why she did. Because if this is what you get for treatment and the care and that, why wouldn't you give up? Lucky enough, I'm 45. I'm only 46 this year, and again, I keep reverting back to it. Why are they writing me off? I just do not get it. It's just like I'm too much of an inconvenience because what they see me as not looking after myself because of my teeth, because of my HIV status. Well, he's not worthy. But someone who's older is more worthy without any conditions. It's much easier to treat. It's the way it feels, and like I say, I don't want to die. I've got so much to live for. There's so much what I want to achieve in life, but your day just goes about of you're dying, get over it, deal with it. When you're not getting anything from, you know, the specialists as they call themselves, you're just like you're giving up on yourself. You shouldn't be. There should be that hope there for me. There should be, well, let's get you through this chemo. Let's see how we handle this tumour. Yet there might be that hope there to remove it, which, will relieve a lot of your symptoms, give you a good, you know, life to start again, if you like. You might have to go through chemo. There's going to be scans and all that. But I suppose you can get used to instead of facing, well, actually, no, you're going to go through chemo. We'll put you through all that, which is traumatic. It really is. It's like, no one understands it unless you've been through it yourself. And, the anxieties which you go through, everything like that. And, yeah. Every time I look at things in life now, I'm like, will I get to see that? Will I ever do this again? Because lately, all what I am is just tired. And I don't think it's the cancer. I actually think it's everything what I'm going through emotionally. And when they're not giving you anything, you're just left to it. You don't hear of anyone. The only people you hear of is friends, and those which you've created in regards to an adoptive family. That is it. That's not occurred to me. I'm not saying a phone call every day you're out, but at least checking in once or twice a week. How you doing? How's your symptoms? How's this going? How's that going? How do you feel? Would you like anything? But it's not. We'll give you a phone call. Right, yep, okay. See you later. Basically, they're just leaving me. Just leaving me to wake up every morning and think, oh, still got a death sentence, haven't I? And it's wrong. Wrong on so many levels. I try and keep hope, but there's only so much what you can do yourself. You know, when you're going to bed at night and the last thing you think is, will this be it today? You know, I may be feeling okay, but you hear so many times people just passing away, you know, doing things, you know, what they enjoy. And yeah. Well, anyway, that was the oncology stuff, as I say. Let me know your thoughts on it, what you actually thought of it all. You know, do you think there were care and compassion there, or do you think there weren't? You know, and you know, am I overthinking things? Well, even if you know of something out there which I should be mentioning, something which I should be calling out, and you know, something which maybe I should be asking, you know, just let me know in the comments and that. Um, you know, so yeah, I'm gonna leave this video here because I've got to get ready now. I've got my storm nurse who will be here in a few minutes. So yeah, hopefully my next video will be a bit more upbeat. But till then, thanks for watching. Keep safe.